Welcome to the Medication Adherence module for trainers. We've designed this as a companion to your trainer's guide to help you visualize the recommended steps for sharing information about medication adherence effectively. As a trainer, your goal is that by the end of the session, participants will be able to explain the importance of taking medications as prescribed by their healthcare provider, identify the different sections of a medication label, describe how to take their medications as prescribed, list ways to address barriers that prevent them from taking their medication, and prepare an action plan. Here's a quick overview of the flow of a complete medication adherence session. The introduction should take around 10 minutes. A discussion titled Ways to Take Medication Correctly should take around 15 minutes. The first group activity, titled Medication Label, should take around 20 minutes, and the second group activity, titled Overcoming Barriers, will take around 30 minutes. Allow 10 minutes for discussing the action plan, and closing the session should take around 5 minutes. You may decide to omit this group activity if you're conducting a 60-minute version of the session. Now that you've seen the big picture, let's talk about the materials you'll want on hand before your participants arrive. Here's a checklist of materials that will help the session go smoothly. Check that you have a flip chart, markers, pencils or pens, name cards, and optionally, refreshments. There are 2 handouts for this session, an action plan for medication adherence and Medication Adherence, What You Need to Know. Print out enough copies for all of your participants before the session begins. There's also an activity card and a worksheet. Print 4 copies of the activity card because you'll be dividing the group into 4 teams, and each team will get 1 copy of the card. This card is used in Activity C. The Overcoming Barriers worksheet for Group Activity D has 1 version for participants and another version for you. Print out enough copies of the participants' version for all of your participants before the session begins. You'll find all originals in the printable materials section of your trainer's guide. Lastly, prepare an attendance sheet so your participants can sign in when they arrive. With your materials in order, you can begin introducing the session. Topic A of the Trainer's Guide covers everything you'll need for getting the session started. As the participants enter the room, greet them warmly to create a welcoming atmosphere. Ask each person to sign the attendance sheet. Write each participant's name on a name card and make sure the card can be seen. After all participants are seated, introduce yourself formally to the group. Ask participants to introduce themselves and provide a simple guideline about what information they should share. For example, you might ask that they state their name, their hometown, and a favorite hobby. After the introductions, explain that the session will last 60 minutes or 90 minutes, depending on the time you've allowed, and tell the participants what they can expect. You can state that there will be group discussions about medication adherence, a variety of activities for learning about the importance of taking medications as prescribed in a fun way, and opportunities to think about and share ideas about medication adherence. Make a special point to encourage participants to ask questions at any time during the session. Remember to mention where the restrooms and water fountains are, especially if there are participants who are unfamiliar with the location. Before you begin the actual content of the session, ask the participants for suggestions about setting some ground rules for the next hour or 90 minutes, and write their suggestions on the flip chart. Keep the rules visible someplace in the room throughout the session. Your group is likely to come up with their own ideas, but typically it's good to include turning off cell phones, keeping all discussions during the session confidential, feeling free to ask questions, and avoiding sidebars by directing all questions to you or to the entire group so that everyone can hear the discussion. You can start the first group discussion of the session by asking everyone, why is it important to take medications as prescribed by your healthcare provider? And what can you do to help take medications as your healthcare provider tells you to? Use a new sheet on the flip chart to write their responses. The Key Points section for discussion B has several information points and suggestions that you could use to start the discussion flowing in case the participants don't begin answering your questions right away. We'll go over the key points now so you'll be familiar with them. They start with a reminder that it's very important that you take medication as prescribed by the healthcare provider. Taking the medications as instructed will help the healthcare provider see if the medications are working the way they're supposed to. Taking cholesterol and blood pressure medications as directed may reduce problems such as heart disease, heart attacks, and stroke. You can say, ask your healthcare provider or pharmacist if you have questions about your medications. Try to go to only one pharmacy for all your medications, and use a pill box to organize your medications. Let your family or a friend know what medications you're taking. Refill your medication before it runs out. Keep a list of your medications in your wallet or purse and share a copy with your family or caregiver. Don't stop taking your medications without telling your healthcare provider. Contact your healthcare provider or pharmacist if you think you're having side effects. Remember to keep all medications someplace where children can't get to them. And finally, tell the participants, if you think you're having a medical emergency, call your healthcare provider or call 911 immediately. Avoid reading these key points word for word. Instead, speak naturally and maintain eye contact with the participants. The first group activity is Activity C in the Trainer's Guide, and it's called Medication Label. The purpose of this activity is to help participants understand the information on their prescription labels. You'll need the 4 copies you've made of Activity Card 1, which is a diagram of a medication label. You'll find sample instructions for introducing this activity in the Trainer's Guide. You'll use your own words, but you can start with something like, now to start, we'll conduct an activity. It'll be fun and easy, so please relax while I explain. Continue introducing the activity by explaining that they'll be learning how to read a prescription label. Divide the group into 4 teams and give each team a number, Team 1, Team 2, Team 3, and Team 4. Give each team a copy of Activity Card 1. Show the participants that there are 2 boxes assigned to each team and point out where the team numbers are shown on the activity cards. Give the teams 5 minutes to read and discuss the 2 sections of the prescription label assigned to their team. Let the teams know when time is almost finished by notifying them about 2 minutes before the time is up. Ask participants to select one member from each team to report back to the group. That member should explain the content and importance of their 2 sections of the prescription label to the entire group. After each team is reported to the group, refer to the key points for Activity C in the Trainer's Guide and share the following extra information. As before, refrain from reading the content word for word and try to establish eye contact with the participants. Explain that a prescription bottle may have stickers that give more information. For example, a sticker might say, "Do not drink alcoholic beverages," or "may cause drowsiness," or "take with food." Explain that if they don't understand a label, they should ask the pharmacist to clarify it for them. If they don't understand their prescription, especially if it's a new one, they should ask their healthcare provider or pharmacist 6 important questions. 1. What is the name of the medication? 2. What is the medication for? 3. How should I take it? 4. When should I take it? 5. What are the possible side effects? And 6. What do I do if I miss a dose? Remind participants that it's important for them to know that the name of the pharmacy and the pharmacy's phone number are listed on the label. This will help them when they need to refill their medication. Conclude the activity by emphasizing the importance of understanding the information on their prescription label, and thank everyone for their participation. The next activity is item D in the trainer's guide, unless you are conducting a 60-minute session, in which case you'll go directly to the action plan. The purpose of this activity is to guide the participants through a brainstorming session for thinking about different situations that may cause barriers for taking medications as prescribed, and finding solutions to overcome those barriers. You'll need your markers, the flip chart, copies of the Overcoming Barriers worksheet for each participant, and your copy of the worksheet, which is titled Worksheet for the Facilitator. Distribute a copy of the worksheet for the participant to everyone. Ask the participants to take 10 minutes to read each of the barriers in the left column and find one or more solutions in the right side column. Ask them to draw a line connecting each barrier with its solution. When the 10 minutes are over, ask participants to share and discuss their solutions for each barrier. After the participants have finished discussing the solutions for each barrier, refer to the key points for Activity D in the trainer's guide and make sure all topics have been covered before you conclude the activity. The key points cover common barriers and suggestions for overcoming them. If the barrier is forgetfulness, solutions include using pillboxes, calendars, magnets, or sticky notes, and link their medication schedule with daily routines like brushing teeth, eating breakfast, or bedtime activities. If the barrier is not understanding how or why to take the medication, solutions include talking with the healthcare provider who prescribed the medication because he or she is the expert in treating their condition. If a person feels that a medication is not important, they should ask their healthcare provider or pharmacist how it will help them. If the barrier is that they don't like taking medications, they should understand that most people don't like taking medications either, but they take them because they know the medication is helping their condition. People who feel that a medication isn't helping them should ask their healthcare provider or pharmacist how it will help them. If the barrier is dependence, and there is a fear of becoming dependent or addicted to the medication, they should talk with their healthcare provider or pharmacist. Most medications don't cause dependency, but participants should be encouraged to talk to their healthcare provider if they have questions or concerns. If the barrier is fear of side effects, remind participants that they should always contact their healthcare provider or pharmacist if they think they are having side effects. The conditions may or may not be from the medication they're taking. The healthcare provider or pharmacist will help determine if it is or is not a side effect. Their healthcare provider may adjust their medication, change it, or instruct them to stop taking it. If the barrier is that they aren't feeling sick, explain to participants that even if they don't feel sick, they need to continue to take the medication unless their healthcare provider has instructed them to stop. When they learn more about their condition, they'll understand more about why they need to keep taking their medication. Remind the participants again to talk to their healthcare provider or pharmacist if they have any questions. Conclude the activity by thanking everyone for their participation. The next topic addresses the importance of having an action plan, and it's item E in the trainer's guide. Distribute an action plan to each participant, then ask each person to review the items on the plan and select one or more items that they'll try to change or improve. The sections on the action plan that pertain specifically to medication adherence are take your medications as prescribed and work with your healthcare provider. The other more general sections include be active each day. Always check with your healthcare provider before starting any new exercise program. Eat healthy and no tobacco. The key points about the action plan in the trainer's guide recommend that you emphasize the importance of an action plan and how important it is to talk to their healthcare provider and pharmacist about their medication. The more they know, the easier it will be to take their medication as prescribed. Explain that there are 4 questions you would like them to ask themselves based on what they selected on their action plan. They are, what behavior would I like to change? Is it a behavior I can do? What must I do to achieve this change? And when will I make this change? Ask participants to select their confidence level for the behavior they've chosen to change. Ask them to select a number on a scale from 1 to 10, with 10 being the highest, indicating how confident they feel about completing their action plan. If a participant's confidence level is less than 7, ask him or her to consider an easier plan. Conclude the session by distributing and explaining the Medication Adherence What You Need to Know handout. Invite the group to ask questions about the handout. Remember to thank the participants for their attendance and participation. Finally, invite them to return to the next session and encourage them to bring a family member or friend. Thank you for your contribution in sharing this important information, and thank you for participating in this training.